if someone had come to me and said, you're going to make the care better, you're going to make the staff happier, and you're also going to save almost $700,000, I don't think I would have believed them. But that is in fact what happened.
Because like every time we come to dialysis, oh, I'm gonna do it again, you know, like you get the excitement. And it's fun.
The hemodialysis unit here at St. Paul's is a quaternary level facility. It's a teaching hospital right in the downtown core of Vancouver, British Columbia. We have a large unit, it's 46 stations, and we offer a variety of services, both to people who live locally and to people who have to come to Vancouver to receive treatment for other things. So the acuity of our patients is really quite variable. One of the key things that we did during the hemodialysis renewal project was we co-located patients with like needs. And as a result, we could get a better nursing model and get a system that actually allowed us to tailor the care for our patients in a way that was a little more individualized. So that involved creating an area called the complex care area, for example, which was 6 dedicated stations where patients who were either admitted to hospital or required intensive nursing resources due to their acuity would be dialyzed. And the good thing about that is that we were able to support a nurse-to-patient ratio of 2 to 1 for those patients, as opposed to the usual ratio of 3 to 1, because in one of the other areas, which we named the involved care unit, we were able to stretch the ratio for nurse to patient to 1 to 3.5 because patients in that area were becoming more independent and were doing parts of their care independently.
It's made the workflow much better, but I think it's also made it much more satisfying that you feel like you're addressing the patient's issues quickly and much more efficiently and better.
The design touched every part of the unit. We had to restructure every single role in the unit, from nursing to social work to renal technician, unit coordinator. We used a lot of tools, including lean methodology, to help us do this. And we restructured the rotations for almost 90 nursing staff members. And in doing so, we were able to get a better match for the care that patients required and the nursing shifts. Part of the savings we were able to manage through doing this, we were able to reinvest in creating a patient navigator role. And the patient navigator's main duties were sort of helping with wayfinding. So patients who come to hemodialysis, following up with them and seeing if they may actually be more suitable for a home modality such as peritoneal dialysis, or what kind of teaching and education would be appropriate for that patient. We wanted to find a way to allow patients to become more involved in their care.
Let's see, so your weight today was 81, and you know what your going weight is, don't you?
So the overall purpose of the Bridge curriculum is really a how-to, step-by-step recipe, if you will, on how to get patients from being in a situation where nurses and staff do things to them or for them to being in a situation where they're able to do things for themselves. And that includes, being part of the decision-making process, and of course the finite tasks and steps in performing hemodialysis. They see a lot of advantages in being in the involved care unit because they get earlier access to their dialysis station. They get a predictable dialysis station every single time they come, instead of having to wayfind and figure out of 46 stations which one's going to be mine this time. They have a lot more control in terms of when they get on and when they get off, and control is obviously very important for anyone, but particularly for patients with chronic disease.
The dialysis part is such a small portion of their whole treatment, and this undertaking gives them the opportunity to be involved in the hemodialysis part of their treatment.
So I have I'm interested to learn. I said, I can do this. And then the first time I did it, boom, right away I got it.
Staff were key in making it happen. because of course they had been doing this work and were experts in the type of care provided on the unit. So engaging them was really key in creating a model that was more driven towards patient-centered care and was actually more efficient for the nursing staff. So we did have several champions, and we had, we were fortunate enough to be able to utilize some of the senior staff in sort of a patient educator type role to help mentor and shepherd the process through. And what we noticed with the renewal project is that the role of the nurse changed in that the nurse became more of a mentor and a coach and an educator. And there was a whole new job satisfaction associated with that I actually hadn't anticipated, because people would get a lot of joy from seeing their patients grow and progress in another way. We measured quite a few outcomes, particularly around the involved care unit, where patients were more involved in their own care. We found that over time, with the education and support provided in the involved care unit, the patients in that setting have had fewer hospitalizations and fewer emergency room visits.
I think it's because of our values that we are able to create environments in which people can take risks, form teams, so that their creative ideas come forward in a way that really is focused on improving the care to those we serve.
I'm actually really proud of the staff and how they stepped up to the challenge of making such a giant leap and such a shift forward.